Yeah, so let's go in now with the Physicians Advisory Group Chair, Dr. Hoa Nguyen, who, Doc, one of the things that was interesting to me in the hearing was this talk about the vaccines, and there was a portion of it where Speaker Terlahi was questioning Dr. Cabrera about the clinics, which have been deputized. There's a few of these tier two clinics, which were basically the governor said, "Hey, need you guys help? Here's a badge. You're now officially part of the public health response." And first, it was with testing, right? And so they were deputized to do the testing. There was testing out of the clinics, and now they were doing the vaccinations. The clinics have also been folded into this vaccination effort. But from what we heard with Dr. Cabrera last night was we had run through 95% of our vaccines, and they've only recently started holding reserves. And one of the things they had talked about when asked if there were issues with the clinics getting more vaccines, they had said, I think it was Dr. Cabrera who had said, I want to say it was him, they had said, well, if a clinic is asking for more vaccines, but then when we look at the system, if they still have like 200 vaccines or whatever, we're not going to give them more. And so when we were kind of talking about that before you came on, Doc, you were talking about public health reporting system. So is that accurate what they're saying, where a clinic can be asking public health, hey, we need more vaccines, and public health shoots back like, oh, well, you still have 100?
Yeah, the clinic, I think like there's about 20 clinic now giving out vaccine, and the three big clinic, AMC, FHP, SDA, we give out a lot. And the reporting system that public health have called WebIZ, is a pretty old system back to like 2013 when Dennis Rodriguez passed the law and adopted WebIZ. It's very complicated. We are trying to find ways to try to somehow get the data from the patient and input that to additional platforms. So that way we don't have to manual input it. It usually take about 3-4 minutes or so to input every patient that you have. On top of that, you have to do your input in the clinic too. So it take a lot of time. And yes, it's complicated. So sometimes the clinic are behind on input the data into the WebIZ to report that to public health. So when the clinic asks for some more vaccine, they are run very low in the vaccine. I know that in the book sometimes it showed 200, but trust me, they use every one of them already, and that's why they ask for more. So no, I would ask public health to work with the clinic and try to make a better system so that way they can know that how much vaccine the clinic use. For us at AMC, we did so much that especially with GDOE, that the Department of Labor is kind enough to kind of give us the two support staff from DOL to input the WebIZ. Because like I said, for 800 people that we do for the GDOE, it takes about 50 man hours to put it into the system. It takes a long time. That's the complicated the procedure that the clinic are behind on reporting to public health. So we were asking and trying to work public health to find a better system that we can communicate back to them to see how many vaccine we use in each clinic, because I say there's 20 of them. I understand that some of them are late in reporting, but I think that it's a very complicated process to try to input the data, but they try their best. Like I said, it's really do, but again, yeah, we do for AMC wise. So we see there's a shortage of Moderna, which is the one that give out to the clinic because of temperature um, in this month in February. So we again, I hope that we have enough for on the Moderna number two to be given by the end of February. We have asked public health to make sure that they set aside the number of vaccine that we're expected to give for all our patients, and including the GDOE on the 24th and 25th of February for the second dose. We require about almost 1,800, I think 1,900 doses by the end of February to vaccinate everyone to meet the date on the Moderna number 2.
Right.
So again, there's two right now. Even our clinic, we kind of put on hold on the new one for on the one to get the number 1 shot because we would like to make sure that our supply is adequate for all the people that require the number 2 shot.
Wow.
So that's we kind of project ahead of time. Like I said, we hope that we have enough vaccine on the island, especially Moderna, to support that. I know FSP and SDA will have the same thing, so they will have to project out and request public health to set aside the Moderna vaccine for them to complete the number 2. For our people that require first shot, UOG with the guard, they're open from 3 to 7 p.m. on Tuesday to Saturday, but they have Pfizer. So we have Pfizer out there that they can give the first shot, and then 21 days later they will get the second shot on the Pfizer.
Doc,
so I'm just looking at, just to clarify with everything you were talking about with the dose 2. So yes, the UOG Cabo Field House, the National Guard, they're ramping up their efforts today through Saturday, and that's 1 to 7 p.m. and they are prioritizing the second dose of the Pfizer vaccine as well as the Moderna vaccine. But they are doing it's limited to 50 per hour, but that's just for the first dose.
Right.
So I think it's only first dose of Pfizer only.
Are we in danger of not having vaccines when it comes around to the end of the month and people need that second shot?
There's a possibility, Chris Sabrina, that we'll be short in Moderna, and people won't be able to get it through the end of the month. Again, we have a window that we can extend beyond the date for the second shot up to 2 weeks. So, if we are short, we will probably have to push those people back to sometime to early March when we get the second the supply from the Fed. But they have 2 weeks window past the date for the second shot.
When you guys go out and do the GDOE outreach and the other outreaches with the homebound, are you given the vaccines from public health, or do you use your existing inventory that is at the clinic level?
Again, when we go out to GDOE and the homebound, like PD and Mighty, and we did Tamuning this past weekend, we asked public health ahead of time to give the vaccine. So we plan ahead of time before we go out. Again, we turn in our request toward the end of February, for a whole month February, in order for us to finish the Moderna number 2 to public health yesterday. And we hope that we have enough supply to finish what we did on January, so people will have to complete the series by the end of February.
Doc, when you talk about the reporting system and how old it is, and public health is saying that, if, for example, AMC still has 200 vaccines, we're not going to give them anymore. Is there a possibility, because of the delayed reporting, that you guys could be showing that you have 200 vaccines, but in reality you have 2 or none?
100%. I tell you, when the clinic asks for more vaccine, they pretty much exhaust the vaccine. And that's something that we need a better report system somehow that we can let them know that the vaccine have been given to someone already. The clinic won't ask for more vaccine if they have 10, 15 vials in the refrigerator. No, they not. Again, Department of Labor have been very kind to us and give us some staff to input the Web IC for the GDOL, GDOE, for the program. So we are, kind of slowly catching up to it, but I think we should be complete today. It's a system that is not easy to use. I present that to administration already, to the governor, and we try to find way to simplify it. But we had to put it into this system. It acts like a inventory supply thing. So you had to put it in, I guess, for the HSS to know how much vaccine you have been used already. I hope that's they use that to give the supply to Guam. That's something that we hope that we are up to date, so that if we're gonna ask for 30,000 doses, that they know that we used 30,000 doses already.
There was the Johnson and Johnson vaccine. I think the last time we spoke, you were mentioning about this, and we're still waiting for this EUA or EAU. I can't remember. EUA. See, I get confused. We're still waiting for the EUA for this. But even if we get it, Doc, is it effective against any of the new variants?
I think that all the immunization, Pfizer, Moderna, Johnson & Johnson, hopefully they come out sometime in March and they get approved. They are effective on the UK variant, but I'm not sure about the South Africa. I'm not well versed in that. Dr. Caprera probably know better than I do on that one. But for the UK variants, they are effective against that one.
All right. Anything on quarantine? Anything?
No, we still keep the quarantine brief. I think we're not going to change that so much. But again, our message I want to put out people is that if you have the Moderna number 2, Pfizer's easy. You only could go to one place at UOG or maybe Public Health in the South have it. But for anyone that have Moderna, try to their best to go back to the same place that give it to you, just because the clinic now have to kind of conservatively manage their vaccine, so they will try to give to the people that was given the first dose in the clinic, so that way when we ask for supply from the from public health, that we don't fall short. That's the thing. It's very crucial now to do your supply inventory to the dot, so that way people won't miss the second shot. Hopefully they get it on time, and again, if they don't get on time, that they have 2 weeks window, that hopefully in March that we can play catch up with the Moderna number 2. Okay, but for right now, I encourage people that don't have the vaccine yet to go to UOG to get the Pfizer number 1, because we still have a lot of Pfizer.
So there's a lot of Pfizer.
Are people are given the choice? Do you want Moderna? You want Pfizer?
I think when they get there, they give them a choice. But again, we try not to use the Moderna number 1 so much, because we need to really complete the number 2 for everyone that need to have it in February. And that's something that we ask public health to really do the inventory supply to the T, because we don't want to let people to ask people to delay for up to 2 weeks, which to me is still safe to use, but some people won't like to be told that, hey, we have to wait 2 more weeks and they're late for the second shot.
Doc, sorry if this came up before, but can you get a first shot Pfizer, second shot Moderna, or vice versa?
Absolutely not. When you get the first shot Moderna, you stick with the second shot Moderna, and vice versa with Pfizer. You cannot mix match 100%.
Thank you, Doc.
Thanks, Doc.
No further questions.
Okay, guys, have fun. I gotta go back and look and listen to the.
You better go input your vaccine inventory.
Okay.
Okay. Okay. See you, Doc.
Bye, Doc.
Yes. Dr. Hoa Nguyen of the Physicians Advisory Group.